Hey guys, Dr. Ryan Davis, founder of WOD Medic. Today I wanted to talk about what I've seen as almost a new epidemic in CrossFit, which is anterior hip pain, meaning hip pain kind of in the crease of the hip joint. We're seeing it in proportions like we've never seen before, where almost every seminar I'm teaching lately has at least one or two coaches that are currently dealing with that anterior hip pain. It will feel almost like a pinch in the bottom of a squat, or if you pull your knees to your chest, that type of thing. What it is not is a hip flexor strain. What we're seeing is that in reality, where it's likely joint pain, where the joint is just sensitized to being in that maximally flexed position from squatting a lot, deadlifting, or stretching even, the joint gets sensitized. But what athletes are doing is then defaulting to mobility to try to fix this problem, where the reality is aggressive stretching, say couch stretching, or rotational stretching like the pigeon pose, banded distractions where we're using bands to stretch the hip joint. These are all just added stressors, meaning the joint is sensitized due to it's being stressed quicker than it can really adapt to that stress. It's getting cranky. But if we double down with mobility, where we're really cranking in rotation, which is very stressful to the joint, or we're pulling our knee to our chest and really flexing it even more, or we're doing couch stretches where we're aggressively trying to stretch out the hip flexor strain, these are all just added stressors to a joint that's telling us that it's overly stressed. So the fix is not more and more mobility. In fact, that is just going to create a cycle of, leading down to a more of a chronic pain situation. So the reality is we need to desensitize a joint. We need to unload the joint, and then we need to unload in painful positions, but then we want to build resiliency back to that joint. But the stretching, the overdoing of the mobility is not going to get you there. What will happen is you'll feel better temporarily after you do a couch stretch or a pigeon pose stretch or a banded distraction stretch. Just through neurophysiological mechanisms, that joint's going to feel better for about 20 minutes at least, right? Where even if the worst thing you could do is double down with some sort of stretching or mobility routine, you're going to get that feeling that you did something good. You relieved your pain for a temporary amount of time. But long term, you're going to need more of that and more aggressive strategies to get that same relief that you did the very first time. But the problem is, it's just further stressing the joint. It's not going to end up fixing the problem long term. So if you're dealing with some anterior hip pain and this sounds like you, make sure you find a good movement-based medical provider out there to kind of help guide you through this calming it down, building it back up process. So there's some great resources for that. We list some providers on our website at wodmedic.com, but also clinicalathlete.com and movementproviders.com. Great resources to find a movement-based medical provider that you can partner up with, if you will, on your fitness journey to keep you healthy and moving good. So hopefully you guys learned something from that. Once again, Dr. Davis with WOD Medic, and thanks for listening.